Hi, this is Wally Taylor, MD, the medical director of Texas Integrative Medicine in Austin, Texas, where I have a practice focusing on people who are sick from environmental exposures. And today I wanted to take just a few minutes to answer a question that I get asked all the time in my practice. And when people call in on the phone, they're asking our receptionist, and that is, do I follow the Shoemaker protocol? Now, the Shoemaker protocol is something that's well known for people that are exploring on the internet the possibility of mold illness or illness from exposure to indoor mycotoxins. And the Shoemaker protocol is named after Dr. Richie Shoemaker, who is a physician who used to practice in Maryland, currently not practicing, but he has a number of followers that have undergone some special training through him in order to be able to treat mold under a certain protocol that he's described called the Shoemaker protocol. Well, the short answer to the question is that no, I know the Shoemaker protocol from A to Z, and I've read most of Dr. Shoemaker's work, but I have never attended his formal training program, and I do not adhere to all of the aspects of his protocol of treatment for mold toxins. My approach to mold toxins is individualized, and it's based off of any number of different clinical protocols, not only Dr. Shoemaker's protocol, but also the protocol of Dr. Joseph Brewer, who's an infectious disease doctor in Kansas City, as well as the American Academy of Environmental Medicine and the International Society of Environmentally Acquired Illness. Both of these are societies that I'm active in. And the thing about it is, the Shoemaker protocol has not been thoroughly validated in scientific research. The numbers of the people that have gone through the program are still fairly small. And although there's parts of the protocol that I very much agree with, there's other parts that I do not agree with. For example, one of the things that Dr. Shoemaker has been quoted as saying is that the binder cholestyramine is the only effective binder to bind mold toxins in the intestinal tract. And we've had significant success using any number of other intestinal binders, for example, activated charcoal or zeolite clay and other binders. The other thing that's controversial, Dr. Shoemaker believes that it's very important to do a number of blood tests called the Shoemaker markers. These would be blood markers such as TGF beta 1, C4A, VEGF, VIP, MMP9, alpha MSH. And although many of these blood markers do vary in mold illness, most of the research is showing that they're not specific for mold toxin illness. In my practice in Austin, where I see environmental illness, most of the patients that I see with chronic fatigue syndrome and brain fog and anxiety, depression, insomnia, digestive symptoms, immune symptoms, especially autoimmune disease, actually suffer from a combination of toxins, not just mold toxins, although mold toxins does tend to be probably the most serious toxin that my patients are exposed to. But our patients also suffer from exposure to any number of biological toxins, such as viruses, bacteria such as Lyme bacteria or Borrelia burgdorferi, parasites, chemical toxins such as pesticides like DDT and glyphosate, plastics, chemicals, food additive chemicals, even drug breakdown products that are very common in our drinking water, such as the so-called xenoestrogens, which have abnormal hormonal effects in our body and are in our food and water. Also, we see a lot of people that are affected by exposure to physical toxins, especially the electromagnetic frequencies from Wi-Fi towers and cell phone towers, and even high voltage power lines, personal Wi-Fi devices like laptop computers and iPads and cell phones. So the Shoemaker protocol is something that I'm very well aware of, and we do follow certain parts of it in patients at certain times. But when I'm asked if I follow the Shoemaker protocol, the answer is no, that we don't. So if you have further questions, I hope you'll give my office a call. I'd be happy to talk to you about this. And if this has been helpful to you, please share this video with family and friends and subscribe to my YouTube channel. I'll be presenting further information about our approach to environmental illness here at Texas Integrative Medicine. Hope you all have a great day.